know that the routine medical procedure for preventing postpartum hemorrhage is not only harmful, but arguably less effective than eating dates? You probably have a lot of questions, so let's just get right into it. Hi guys, I'm Bailey from Birthing Bravely and Beyond, childbirth educator trained in hypnobirthing and the Bradley method, and home birth mama to 3 babies. And I had amazing home births all 3 times. So on this channel, I talk all things home birth or planning a birth that's empowered, that allows you to ask the right questions to your care provider. So today I am going to debunk some of the things that you may be told about postpartum hemorrhage, what it is, actually how it's managed, how to prevent it, and just some questions that you can go into your midwife or obstetrician with that you can talk to them about. All right, let's get into this. Postpartum hemorrhage is a complication that can happen in any birth setting, but the research shows that it is more likely to happen in a hospital setting. And you might think, well, why? You're in a hospital. I will get into that more. Okay, so you've probably never heard of this before, but a lot of care providers provide the option of having active versus expectant management of the 3rd stage of labor. And what that means is, how are you going to deliver the placenta? And you're probably thinking, what do you mean? Like, I'm just gonna push the placenta out after I have the baby, you know, all good. Well, that's what you would think, but that's not always the case. Sometimes complications arise. More often than not, they don't. Yet, active management of the 3rd stage of labor is actually extremely common, which means that it's augmented by doctors or healthcare providers. It's so common that a lot of times birthing mothers don't even know that they have the option to choose between active and expectant management. Again, active is when the doctors or the healthcare providers actually take the steps to make sure you deliver that placenta using some form of synthetic oxytocin. Typically, it's called Pitocin, and typically it's injected in the thigh, sometimes in the butt. Now, this happens after the baby is born, and what it does is it stimulates contractions. It stimulates the uterus to contract. But you might wonder, isn't my body supposed to expel the placenta just like my body expelled the baby? Why do I need synthetic oxytocin in order to do so? Expectant management allows your healthcare providers as well as yourself to decide how things are going. So baby comes out, baby's born, we're doing skin to skin, we're doing all of the holistic things that we should do after birth in order to encourage the body to naturally contract. The body will naturally contract. I know, crazy, right? You'd think this would be more common, but it's not. So anyways, the body contracts, the placenta comes out. I think we underestimate what our bodies can do. And I understand that there are extenuating circumstances, but in more times than not, we rely on modern medicine for such a physiological process. Birth is just so incredibly natural, and the less we intervene, the better. The general definition of postpartum hemorrhage is losing more than 500 milliliters of blood after the baby is born in the first 24 hours of giving birth. That is for vaginal birth. Cesarean section, it's 1,000 or more. But why 500 milliliters? Every woman is so different. This is such an arbitrary number that is most certainly not applicable to all. If we move away from pathologizing, you know, what is the average amount of blood or blood loss, then we can redefine what it means to hemorrhage. So for a mother with adequate iron stores and a healthy blood volume expansion, which is about 1,450 milliliters of circulating blood, a loss of over 500 milliliters in this case may present with no additional challenges at all. Yet for a woman who has had a hard pregnancy, 500 milliliters may be too much blood loss for her. About 80% of the time, hemorrhage is the result of uterine atony, which is essentially the uterus not contracting. So without the uterus contracting, we have the blood vessels behind the placenta failing to close. And so blood vessels are staying open. What happens? A lot of additional blood flow. But postpartum hemorrhage can also be caused by physical trauma or trauma during the birth process, like tearing, forceps, episiotomy. Another cause of postpartum hemorrhage could be placental abruption, and this is just when the placenta prematurely separates from the uterine wall. So as you can see, there are quite a few different instances in which a mother can have a postpartum hemorrhage in the third stage of labor. But synthetic oxytocin, or usually Pitocin, administered only takes care of the first one that I talked about, which is the uterine atony. And again, as you remember, this is referred to active management of labor. So this active management won't address if postpartum hemorrhages are due to any other things. Also, when we're looking at Pitocin, we can see that it has 0.5% chlorobutanol, which is a chloroform derivative used as a preservative. We talked about how the third stage can prevent uterine atony, but I want to talk about the risks involved with using Pitocin or some other form of synthetic oxytocin. So of course, there's always the anaphylactic reaction risk, spasms of the uterus, uterine rupture, pelvic hematoma, cardiac arrhythmia, nausea and vomiting, headache, postpartum hemorrhage. In women with risk factors or who have experienced anxiety and depression in the past, you are at a 36% more likelihood of experiencing postpartum depression and anxiety, literally because of this synthetic oxytocin. And for women who have had no previous depression or anxiety at all, it increases your risk, the drug, Pitocin, increases your risk of postpartum depression and anxiety by 32%. What we know about Pitocin is that it reduces the blood loss by about 80 milliliters. Would it even make a difference at all? Yet, the World Health Organization recommends doing active management of the third stage of labor in 100% of cases for women. But I just want to talk about oxytocin for a minute, the real oxytocin. The real oxytocin is naturally occurring and it's produced in the brain by the hypothalamus, and it's released both as a neurotransmitter and through the pituitary gland. It facilitates feelings of love, bonding, trust, and happiness. There's always risks to everything, and you kind of have to do a risk-benefit analysis and see what's best for you. And that's why I love expectant management, because when you decide that you want expectant management, it means that if you don't present with any risk factors for not delivering your own placenta with your own body, then you don't need to administer synthetic oxytocin. Okay, so now I want to talk to you about the risks of postpartum hemorrhage. So I'm not talking about the risks of Pitocin. I am talking about what are some risk factors that may cause postpartum hemorrhage, okay? The biggest one, honestly, you guys, I feel like this comes up all the time. The biggest one is induction. Induction and augmenting with labor, previous cesarean, birthing multiples, obesity, and preeclampsia. The research is indicative of postpartum hemorrhage being far more prevalent and common in hospital births than it is in home births. This isn't a surprise due to the fact that there are a lot more augmented labors in a hospital birth, but of course, there are also more high-risk births taking place in the hospital. But let's take out the high-risk people because it's not fair to include them in this. Let's look at people who are women who are low risk giving birth in the hospital, women who are equally as low risk giving birth at home, okay? Yet still, the women who are giving birth in the hospital are showing a higher instance and likelihood of postpartum hemorrhage. It seems that a lot of this could be due in part to the fact that hospitals aren't focused on the physiological process of birth. And let me just kind of define that for you, okay? I want you to picture a dimly lit room. It's calm, it's peaceful, it's quiet, it smells of your usual home smell, whatever that is that you prefer, as opposed to the hospital where there's bright lights and people in and out, and sometimes you can hear the sounds or the screams of women in other rooms. It's very sterile, not as soft and cozy, I guess, if you will. You're typically in the narrow hospital bed, whereas at home, you're in your, large bed or the water that you've chosen to give birth in or where you're most comfortable. You've been nourished by eating food. Baby comes out and is immediately brought up to your chest. The blanket goes over top of baby, but ultimately baby is skin to skin with you. No hat on baby's head, which allows you to smell baby's head, get in all those smells, which is releasing even more oxytocin. So this holistic physiological birth allows for oxytocin to be free-flowing and less likely to be disrupted. That says a lot about why in home births, postpartum hemorrhage is less likely. I just want to stop for a second and ask you, is this home birth strategy making sense to you? Is what I'm saying resonating with you? Because if it is, comment empowered down below so I know that you feel me on this, guys. You need about 1,000 calories per hour when you're in labor. The problem is when you're fasting or you're not eating, you're gonna get more tired. And what happens when you're more tired? The length of your labor increases. And what happens with the length of your labor is increasing? Well, in a lot of cases, augmentation. Okay, you've been laboring for so long, like we're gonna induce you, or maybe we should just move this along and look at our other options here. When in so many cases, you just need to eat something nourishing. Like seriously, guys, consider the things that God made, that God provided you with before going and looking at the things that a hospital provides you with. God has nothing to profit. The others do. A study actually proved giving mothers dates to eat after they deliver the baby was proven more effective in expelling the placenta than Pitocin. You should always have them on hand, and if you don't like dates, you can do smoothies or you can do date squares by mixing them with oats. When birth is supported with holistic care, it's proven to be safer than routine hospital care with a routine jab of Pitocin. Mamas, we need to understand and we need to respect ourselves and the physiological process of birth because it's beautiful. Thank you so much for watching another one of my videos. I will see